Good afternoon. For today's interview, we're going to be talking to Karen Swain, who's a nurse practitioner that's the co-owner of a new aesthetic practice in Naples. Karen's a nurse practitioner and she's been practicing aesthetic medicine for roughly 20 years. Karen?
Good afternoon, Dr. Swain. Thank you for having me.
So, Karen, you've been doing this a while.
I have.
What seems to be the differences that you've seen over that time with respect to filler use?
Well, there are quite a few changes in the last few years with filler use, both in the way they're injected and with the fillers themselves.
Tell me about the ways with the injection. What's the differences?
Well, back in the day, a few years back, we would just simply fill in lines and wrinkles and send patients on their way. Today, it's more about facial rebalancing, evaluating the entire face, not just filling one area, but basically evaluating and rebalancing.
A lot of my patients talk to me about gravity and about how it seems to have a bad effect on their life.
Yes.
How do you offset the effect of gravity to make people have the look that they desire?
Well, when I mentioned rebalancing the face, like I said, it's not just about filling in lines and wrinkles anymore. It's about repositioning the tissue to kind of offset gravity. We usually start from the top down. We do a lot of temple filler, which will kind of pull up the entire face. We do a lot of cheeks and lateral jaw lines, which kind of like just repositions the tissue back where it was before gravity did take effect. By doing that and repositioning the tissue, you'll find that you use a lot less filler in those lines and wrinkles.
So when we first started, we had one hyaluronic acid product, but now I see that there's dozens of them. How do you decide which one to use?
Well, if you recall, when we first started, even before hyaluronic acids came out, we were using bovine collagen. And the problem with that is it required skin testing and waiting to make sure the patients weren't allergic. So we kind of celebrated when hyaluronic acid came out. But now there are many types of hyaluronic acids, but they're still hyaluronic acids. The difference is now is just the properties of the injectables themselves. There are softer ones, there are more firm ones, there are more elastic ones, and we choose which ones we want to use based on where we're going to put them in the face.
So for lips, for instance, what type of one would you use in the lips?
For lips, we want something that would be pliable and more elastic because we're using our lips frequently. We're talking, we're moving, we're eating. So you wouldn't want something that's not going to move with you. And the same could be said about your cheeks. You know, when you smile, when you talk, when you move, you want something that's going to move with you.
But I've heard about layering of products. What does that mean?
Well, that's true. We frequently will use multiple different types of products in the same patient and frequently during the same session. A good example of that would be in your cheeks. Sometimes we will come in with a stiffer, more firm, less elastic filler, and we'll put that out in the edges or the more lateral aspects of your cheekbones to use as a base. And with that, you'll get a lot more lifting of the tissue, and then we'll come in the more medial areas of your cheek and inject a little bit more superficial with something that's a little more elastic. That way, when a patient smiles or moves, the filler will move with them and give you a more natural appearance.
So I'm assuming rather than doing the same thing on every patient that walks in, you like to evaluate each patient to make sure you're doing exactly what they need.
Yes.
So how much do you charge for your initial consultations?
Oh, a consultation is free. You never know what you're going to need or what's best for you. So absolutely, we will see you, evaluate you, and come up with a plan of treatment that best suits your needs.
And what's your website in case somebody wishes to reach out?
You can reach out to us at bioaestheticsnaples.com.
Okay, perfect. Well, I'm sure many people will be wanting to come and see you.
Well,
thank you very much for your time today.
thank you.